My name is Guido Costamagna and I'm the head of the Department of Gastrointestinal Endoscopy at the Catholic University here in Rome.
My name is Cristiano Spada.
My name is Cesare Hassan.
As you may know, colorectal cancer is still a major cause of morbidity and mortality in the Western countries. In theory, colorectal cancer screening is effective in reducing colorectal cancer incidence and mortality. However, population adherence to colorectal cancer screening is still disappointingly low. And this may be at least in part related with the fact that colonoscopy is perceived as an invasive and fastidious screening test. Colon capsule endoscopy represents a non-invasive, painless, swallowed colonoscope that is able to explore the colon without requiring sedation and air insufflation. It's about 3 centimeters and it has 2 cameras that enable to take picture from both ends at a frame rate of 4 frames per second. It has a total operating time of about 10 hours, and of course there is a lot of enthusiasm regarding this new technology. However, only few studies on colon capsule have been published up to now. These studies considerably vary in terms of study design, selected population, and technical performances of the colon capsule endoscopy, leaving some uncertainty on the real accuracy of this procedure.
Okay. To address this issue, we decided to perform a systematic review and meta-analysis that has been recently published on clinical gastroenterology and hepatology with the title Meta-Analysis shows colon capsule endoscopy is effective in detecting colorectal polyps. Main aim of this systematic review was to estimate the real accuracy of colon capsule for polyp any size, significant findings, and to ascertain the possible bias of the literature. For this purpose, we retrieved all the articles in Medline and Base Endoscopes that focus on colon capsule. In particular, we included only those studies in which subjects at average or increased risk of colorectal cancer underwent colon capsule endoscopy and within subject complete colonoscopy. Preliminary recommendations for meta-analysis were adopted for this analysis. Of the initial 121 studies retrieved in the literature, only 8 studies, including 837 patients, satisfied the inclusion criteria and were eventually included in meta-analysis. Prevalence of polyp of any size and significant findings, defined as those larger than 6 mm or more than 3 polyps, were high, since most of these studies were performed in enriched disease populations. According to our meta-analysis, colon capsule endoscopy sensitivity and specificity for polyps of any size were 71% and 75% respectively. Quite surprisingly, when passing from polyp of any size to significant findings, sensitivity slightly decreased to 68%, whilst, as expected, specificity improved to 82%. We also addressed colon capsule sensitivity for cancer. In detail, colon capsule endoscopy identified 16 out of 21 cancers depicted in these studies, corresponding to a colon capsule sensitivity for cancer of only 76%. No high heterogeneity was detected in any of our estimates. When considering the non-randomized design of these studies, this strengthens the robustness of our estimates. A random effect model was anyway chosen to compensate for the moderate heterogeneity detected in 2 of our estimates.
Regarding quality of the included studies, the strongest aspect of this analysis is that colon capsule accuracy values were based on an independent reference standard, actually colonoscopy, that was performed to all the subjects within a very short period of time. The weakest aspect is probably represented by the limited clinical applicability of the study results, since only in one study a consecutive enrollment was undertaken, so that the withdrawal rate is likely to be underestimated. Moreover, all but 2 studies dealt with disease-enriched population, so that our result should not directly project into a screening setting.
In conclusion, we feel that our systematic review provided reliable estimates of colon capsule endoscopy accuracy. According to these findings, colon capsule endoscopy sensitivity for polyps seems to compare favorably with the other non-invasive options for colorectal cancer screening. Colon capsule endoscopy sensitivity for cancer is, however, still suboptimal.